notice here because I can't keep working here for free, and that's what I'm doing.
Left behind, the crisis facing people who depend on home health care. Good evening, everyone. Ohio's system to help those who depend on health care at home is failing for some.
Specifically, the aides who haven't been paid for almost 2 months and their patients. In a story you'll see only on Local 12, reporter Jeff Hirsh explains how good intentions can lead to bad results.
Well, I have done quite a lot of stories, but this is one which makes you sad and mad at the same time and really feel for the home health care nurse, the family, and the nurse's patient.
In this baby picture, Robin Egner looks like any other healthy little kid. 51 years later, it's a lot different.
She doesn't walk, talk, or nothing. She's just like a little newborn baby.
Brain damaged at birth, Robin was not expected to live a year, but she has, needing constant help to do anything. Her parents, Roger and Margaret Egner, provided that care themselves for Robin's first 31 years.
And the only reason she's here with us today is because we love her, we care for her, and we insist nothing but the best for her.
For the past 2 decades, that nothing but the best includes home health care nurses like Tammy Talby. Tammy and 2 other nurses work in shifts, morning through night, 7 days a week, giving Robin food, medicine, baths, and a human touch. The state of Ohio picks up the tab. But now, Robin's 3 nurses have given notice. They're quitting.
May 31st was the last time I got a check, and it was for 1 day.
Tammy and other independent home health care providers have fallen between the cracks as the state of Ohio changed the way these health care aides are paid. But the nurses caring for Robin and other providers we've heard from as well are not getting paid at all. Tammy is owed more than $5,000. She has kids of her own and needs a paycheck.
I can't keep working here for free, and that's what I'm doing. It really hurts me to have to leave here because, I mean, we're leaving her in a vulnerable situation. We're leaving the parents with no one. I mean, it's just a mess all the way around, and it's not fair.
Here's the problem. On June 1st, the state of Ohio changed from paying the aides directly to having insurance companies handle the program. For Tammy, that's Aetna. Tammy says she's called Aetna repeatedly, getting the runaround, but still no money. So in a couple of weeks, when her notice is up, Tammy will say goodbye to Robin and her parents.
All right, girl. You want to go to sleep now?
It was the hardest thing I had to do to give them my notice because I know they know I don't want to go. But, I mean, we have to. We can't just keep staying and, you know, not getting paid.
This is all devastating for the Egners, who lost their only son Jody in a military helicopter accident in 2002. The Egners rely on religious faith to make it through the day.
Robin's all we have left. It's my duty as her mother. Yeah, I could throw her in a nursing home, cost the state more, but the state chose this program so we could keep our children at home. And now look what's going on. It's not right.
A website which handles Tammy's electronic billing says Aetna is experiencing a technical issue processing electronic claims, although some claims seem to be going through. But Tammy has not seen a dime since May 31st. Tammy says if that money starts coming, she'll stay on the job. But no one is optimistic. The Egners, age 70, are preparing to take care of Robin by themselves.
I will care for her if I have to crawl on the floor because that's how much I love her. But with what she's eligible for, I should not have to be doing that.
A spokesperson for the state Medicaid department told me he believes problems like Tammy's are few and far between, with more than 100,000 patients involved in the insurance change. But besides Tammy, we've heard from other independent providers in Westwood and Harrison. We heard from a quadriplegic man who said he's going to lose the aide who has cared for him for 10 years because she has not been paid. And we also received a Facebook post from someone up in Lorain near Cleveland saying it's a problem there too. One local independent provider said her car has been repossessed because she's been unable to pay her bills. And Tammy Talby says she's so fed up she has contacted a lawyer. You know, maybe there'll be a lawsuit out of this.
Yeah, and as you can imagine, we wanted to hear from the folks from Aetna.
Right.
We've left both a phone and email messages for the person who's supposed to be their spokesperson, and we'll have the company's response just as soon as they provide it.
Absolutely.
Okay, thanks, Jeff.